must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show.
Hello, everyone, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Stephanie Wyrock, and today I'm actually joined by a guest host, Keaton Ray, who is the founder and CEO of MovementX, and was also a member of the planning committee for the Graham Sessions. So there was a really interesting topic at the Graham Sessions, and for those of you who don't know what Graham Sessions is, it's basically a think tank of physical therapists coming together and talking about issues that exist in healthcare and in physical therapy, and how can we potentially solve those issues. And there was a really interesting discussion at Graham Sessions that talked about APTA membership. And this got me really interested just in general in professional memberships for different professions. So I want to do a series of interviews with different professions about why they're not members of their specific professional association. And obviously I'm a physical therapist, and so why not start it off with physical therapy? So I thought Keaton would be a great person to have as a co-host today because she kind of helped facilitate this conversation. And so Keaton, thank you so much for being a guest host today on the Healthcare Education Transformation Podcast.
Thanks so much, Steph. I've been a fan for a while, and it was an honor for you to ask me to join and co-host. So hopefully I can live up to your awesome work so far. Our guest today is Dr. Jen Esker, more commonly known as her Instagram handle at DocJenFit. So if you have your phones out, go ahead and pull them out and look her up right now. She's a great one to follow. Jen is a physical therapist, a doctor of physical therapy, who has almost 500,000 followers, or just over 500,000 followers, I should say. That's an important differentiation, I believe. So over 500,000 followers on Instagram, where she uses her doctoral knowledge to communicate with the general public about health, fitness, and the mind-body connection. She's done a fantastic job at producing a strong personal brand over the past 4 years since she graduated with her DPT from Loma Linda University in 2015. So thank you, Jen, so much for joining us. It's an honor to be here with you today. Tell us a little bit about yourself and how you got to be where you are today.
Thanks for having me on. It's good to see you ladies again. So my presence on social media grew actually while I was in physical therapy school. And I got involved with what's called calisthenics, which we all know is just moving your own body weight, but there became like a sport type thing outside. And the people I connected with were on Venice Beach, and we got to just work out on the beach and play on the bars. And I got connected into this community and started to grow this social media following just by collaborating with all these amazing humans that were doing crazy things with their bodies. And it was kind of just like my side hobby from studying and schoolwork. And and I just continued to grow. And it was once I graduated physical therapy school that I decided, I would love people to know that I actually have some knowledge about the body, and not just what I can do with my body, but I can actually educate a little bit. And so I started to step out into this world of education and share some of my knowledge, which was really scary because as a new grad, you're like, I don't know anything yet. But I just started to lean in and realize that people started to gravitate toward it a lot more, which made me so excited. And that's been my journey since graduating physical therapy school, is to see what value can I continue to push for people in order to get them to continue to take note of their own body and kind of dive into the responsibility aspect that they get to kind of own.
Yeah, that's really incredible, Jen. And props to you for taking the knowledge that you got in school and combining that with a movement passion that you had and using those two skills to bring that to the general public outside of the physical therapy realm. So something that I really respect that you've done for the profession so far is with one single Instagram post about movement or health or the body, you reach more people than I could probably treat in 6 years. So really, you've done a great job of branding yourself, but you're also contributing to a professional brand. So for listeners who are listening to this podcast, tell us a little bit at how you established your brand, the look, the feel, how you grew what you're doing.
I mean, I would say it wasn't until like the last year that I've really gotten clear on what does brand image even mean, and what am I creating? And I just kind of started cultivating what I knew that an audience would be gravitated towards. So I mean, I was building a brand, obviously a personal brand in the very beginning, but I didn't really know where that was going to translate into. And my Instagram handle when I first started on social media and through fitness was actually Jen_ES_care, because that's how you said my name. That's how you pronounce it. And it wasn't until I graduated that I was like, I would love people to just be able to see that I am a doctor of physical therapy, and I wanted to still tie in fitness so that they didn't feel so disconnected from what I've already created. So that's when I was like, okay. And I named it Doc Jen Fit, and I just changed the name. And it made me so happy that people really started to understand that. I mean, even with having doc in the front of my name, people were still like, oh, you're a doctor. Oh, that's so crazy. They still didn't get it. But it was something I had worked hard for. I was in school forever, as you guys know. And I was just very proud. And I wanted people to feel that credibility as well. And so that's why I renamed and kind of rebranded just through that aspect. And then, as far as posting goes, I didn't have this like look or color scheme or anything like that. It just was like, I know that how I could draw attention into how I'm going to start speaking into the body was using half screen of anatomy and kind of having like a red dot on a shoulder or a red dot on a knee that draws people into that post. And so that they can then watch the video and say, oh, these are the exercises that I need to be doing. And when I started to draw people into that, and it just started picking up more traction, and all I did was say, what are people liking? And I would ask questions and say, what do you want to learn from me? What do you guys like? And I still shared my own personal journey through fitness and life and all of that, but on a very minimal scale. And I focused more on creating educational content because I knew that's what was drawing people in. And I didn't know I was drawing people in to create a business. I didn't know I was going to launch online programs or create anything. I was just really focused on being the best physical therapist I could be. And then at the same time, I was really focused on how can I continue to give value since it's already growing in such a beautiful way. So it was really just about creating content that would create value and learning and getting mentored outside of that, and working in a clinic is where my focus was.
I love that. I think that you make some really amazing points about what really makes you stand out just as a physical therapist and also on Instagram. I mean, how many people get all of their fitness knowledge from people who don't have their doctorate degree? So I love that you've been able to do that. What tips could you give we have a lot of new grads that are our listeners. We also have a lot of people who are very seasoned and teach students. Mm-hmm. What are some tips that you can give our listeners regarding personal and business branding?
What I see happen a lot is that people are wanting to almost prove themselves. And so they start using and creating content that they know will impress the physical therapist or a chiropractor, or say, oh, look at this cool new exercise that I created. And they're almost doing it more so out of ego and out of just trying to prove yourself. Especially if you're a new grad, I think it really comes out of the gate wanting to prove that I have the knowledge. I can share this. I can do this. Where I was almost the opposite. I came to the gate and was like, I don't know if I have the knowledge to actually educate, and I don't know. So let me just keep it super simple and see if that helps people. And it was. And people started gravitating toward it. And I realized that because I was making it so easy to understand, which I thought everyone already knows this information, why am I even putting it out there? It only attracted more, and it only attracted a bigger audience. So I think people really get to get clear, like, who am I talking to? If you want to talk to more of the sports realm, if you want to create an audience that is more like football and all these other things, then create really complicated drills and make it seem like a little bit more complicated in that way would probably attract that audience. If you're trying to attract the general population, talk like you're talking to a third grader. People don't know the body, and explain it very, very easy for people to understand. And then again, if you want to, it's just learning how to like navigate this world of what is the audience that you're trying to create and attract. Because if you're only talking in very technical terms and very clinical terms, you're going to attract physical therapists and chiropractors and other people who might want to learn about that. But is that who you really want to market to at the end of the day? So it's just, you get to drop ego and really focus in on who the audience that I'm trying to serve. And for me, very much so, I'm trying to serve the general population who are not personal trainers, who are not chiropractors and physical therapists, and who have zero idea why they should even think about the body in that kind of way. And so that's how I talk, and that's how I'm trying to put out content that makes it very easy, very accessible. And I also believe that's one of the reasons it's been able to grow as fast as it has. And I also know that it's social media, and social media is like a billboard. Like, what is going to make you catch the eye? What is going to make you turn and look and want to follow that person? And so I'm not trying to attract, men just based on how I look, but at the same time, I also understand being in a sports bra and wearing, athletics in that way is going to be more attractive. So I do that. But I'm not also posting just like booty shots and all these other things. I'm also cognizant, like, I am on a social media presence. So you have to play into that in some kind of way and create this billboard effect for people to want to attract. And also, I, post the anatomy photo because I know it's going to draw the eye. So you also get to play into the fact that you're on social media and how, if you want to gain an audience, how is it that you're going to do it? And then what is the audience that you're trying to serve?
I think that that's a really great point. I do think that one of the things that maybe we don't do as well in the profession is talking to the general public just as a whole. Like how you described how you need to make your Instagram posts is like how you should be talking to patients, right? Every day.
Mm-hmm.
Like you're not going to be like, oh, your lateral meniscus is blah, blah, blah. You're just going to say, something in your knee isn't necessarily right. If we do these certain stretches, it's going to feel better. Keep it simple, stupid, I guess, is the famous saying. Over the years, the profession of physical therapy has actually really struggled in defining what we do as physios. Actually, in 2013, to kind of consolidate or compensate for this, APTA adopted a new mission statement, transforming society by optimizing movement to improve the human experience. So what do you think of this statement, Jen? Do you think that this is a statement that successfully brands our profession? And do you think that there's maybe any modifications that we could potentially make to the statement to really make our messaging clear?
I think the one reason as well that my audience has grown is because I've built a community based on connection as well. Like, I am sharing my personal journey. I am sharing something that is a little bit more connecting. And as I learn and as I grow, I'm open and I'm willing to share. I'm willing to share who I learned it from. I'm willing to share anything open and vulnerably. And I think when you have more of a connecting piece rather than just movement, because people don't, what is optimizing movement? What does that mean? And why would I want to do that? I walk, I sit, I move, I'm fine. It's for me, it's good. And I think us as PTs would understand it because that is what we're trying to do. But I think when you're talking to the general population and when people think of physical therapy, what is it that they think of? And typically that's, my doctor told me to come see you. I'm in pain. I just had surgery. whatever it may be. So we also have to think about, okay, what are people thinking when they hear physical therapy, and how can I tie that into the mission statement so it attracts exactly who I'm trying to talk to? Because right now I think it attracts personal trainers, physical therapists, chiropractors who already know what optimizing movement means, but I don't think the general population cares enough about that right now.
I agree wholeheartedly, Jen. I think PT, and you spoke to this in developing a brand. I think PT, the brand of physical therapy, is suffering, or maybe has been suffocated, one of the two. And the world of fitness and chiropractic and movement, we don't own that anymore. We don't own movement as physical therapists. That is drastically spread across all sorts of professions. In fact, I met somebody on a plane who was coming home from a movement therapist conference. So a movement therapist, I've never even heard of that. And it's terrifying that that exists out there. So right now, the truth of the matter is PT is not sexy, right? People don't want to go to PT. They don't seek out PT unless they've had a positive experience already. So what you're doing with your brand is you're making PT sexy again, right? You're making people, their eye drawn to it. You're educating them in a way that they can comprehend. You're making them understand what the meaning of optimized movement actually is, right? And that is what we really need to do a better job of, both on an individual basis in our education in the clinics, but also on a grander scheme in the association. So with that, let's get to the meat of the matter. Here's the tough question for you is, and I know you're okay with me calling you out here, but you were the only non-member at Graham Sessions this year, right? And so first of all, thank you for coming and knowing you'd be the only non-member and speaking strongly and proudly and helping all of us who are members realize where our shortfalls are. So for a little bit of context here, so as a Graham Session Planning Committee member, we had a session called Does Membership Matter? And I wanted to find somebody who was not a member, who had had success and influence on the profession, to come and speak to why they were not a member. So Jen, before we get into some of that context, tell me, how did it feel when you were invited to come? Were you nervous? Were you hesitant? Were you excited? What went through your head?
Well, first of all, I heard I was like not the first pick. So I was like, what the heck? Why wasn't I thought of first?
You were by far my first pick, Jen.
Okay, great. Yeah, when Karen first reached out and asked me if I would be open to something like that, I was like, yeah, sounds good. I had zero hesitation because I'm not embarrassed at the fact that I'm not a member. Like for me, it's just is what it is because that's where it's been for me. Like I haven't known, besides needing to have one and having to pay for it within my, within being a student. And I knew that that was where some of my money was going to, was being a part of the APTA. It wasn't something that I took out separately and knew the meaning of why I needed to carry it forward. And maybe they went over that in school and I missed it. But it wasn't really communicated. And so for me, it was like, yeah, I'll go speak. Like if people are wanting me, I didn't feel any pushback from, or like resistance to it, I guess I should say, because it just is what it is for me. And so if people want me to come speak, like I'm happy to come share my story.
Well, thank you for coming and sharing your story. You really did quite an amazing job. Give us an idea of the thought process behind becoming a member versus not becoming a member. Was that ever a question for you, or was it just, did the question never even surface prior to Graham?
It really didn't. And I think what I was seeking out of physical therapy and was just, who can I call upon for as a mentor? Who do I respect? Who do I look up to? And honestly, a lot of that was through the realm and the community that I was creating on Instagram. So I didn't know if they had APTA membership or not. Like I just looked at what they were doing, what they were creating, how they were teaching, and I admired that. And so those are the people that I kind of sought out, and those are the people I connected with. And for me, it was just, who can I reach out to as mentors? Who do I look up to? And some of them were chiropractors. Some of them weren't even PTs. So it was just, again, about like, I'm trying to help humans. And whatever way that looks like, that's what I'm leaning into. So it wasn't based on needing a certain structure or needing things to look a certain way. It was really just based on who do I look up to so that I can continue to learn how to help a human better.
I think you really hit on a big point there, Jen. Community. I mean, you found your community in your Venice Beach fitness community. Keaton and I have found a community in APTA. There are other people that have found a community in other organizations as well. And I think that that's kind of the biggest point that maybe came up during this discussion. Why do you think that this is the main reason that people decide not to become members of the APTA, or what's kind of your thought process behind why people don't become members of the APTA?
For me, I think it's just understanding the value and community aspects. Like if you're going to make me feel like I'm part of something, and it's going to unite all PTs across the board, then yeah, sure, it's something that I want to get into. But if it's something where it's like, well, are you interested in learning from a chiropractor as well? Or is it going to be something segmented where it's just PT or we're fighting against each other or whatever that may be? Because I don't also want to be in an environment that tears anyone else down. And so I think it, like, again, for me, I'm just like open. Like one of the reasons I loved taking like an SFMA course right away when I became a new grad is because they had a PT, a chiropractor, and an athletic trainer helping and facilitating the entire workshop. And it was about, again, helping humans. And so if we can create a space, and I get that it's just for physical therapy, but if we can create a space that is inclusive for physical therapy, but feels like open enough to welcome new ideas and new ways of how we're moving forward, then I think that's how it becomes more attractive. That's how it becomes more of a community aspect for PTs to say like, hey, oh, you learned this from a chiropractor. Can you teach us all? Or, hey, you're building a social media. Or, hey, you have a podcast happening. That's so amazing. How are you doing that? How can we support? And it's continuing to say, how can I support what you're doing so that you feel a part of the community, rather than how are you doing that separate and why aren't you a part of us? Because that's not going to make me feel connected. But if I feel like, awesome what you're doing, how can I support, which is the only way I've been able to collaborate and meet my mentors and do all those things, is based on collaboration and support. Like, you're up to this, great, how can I support? And that's what I want to continue to move into. And I think that's what's going to attract other people in. It isn't like, oh, they're doing that, they're doing a podcast, they're doing other things or they're creating online programs. I don't understand it. I don't get it. Why aren't you an APTA member? You need us. You need this. Like, don't tell me what I need. Tell me how you can support me and why I want to be a part of the community.
Absolutely. I think a major factor that's been discussed in the APTA in the last, maybe 5 years. I've only been involved for 5 years, so it likely was before that. But prior to my involvement, there's been talk about how we were originally so internally focused as an organization. We were fighting towards autonomy, right? We wanted to be autonomous practitioners with direct access. And we didn't want the chiropractors to approach on our practice acts. And we didn't want this, and we didn't want that. And to be quite honest, I think many people would agree that bit us in the butt. So like you said, we became non-collaborative. We became very internally focused, a little bit self-centered. And there has been a huge push in the recent years since I've been involved in breaking down those barriers that we built maybe a decade ago. And so looking at, okay, so, maybe physician-owned practices aren't the worst thing in the world. Oh, okay, maybe chiropractors and PTs, it's okay if we have similar practice acts. Okay, maybe it's okay if, the acupuncturists and PTs collaborate on dry needling. So I think we're moving in the right direction, and it's people like yourself and people like Steph who are pushing that ball forward constantly. That's going to make the association grow and evolve over time, so that we're more collaborative and we have that sense of community. So yes, amen to everything you just said completely. Kind of to deviate topics a little bit, when you were in PT school, like you said, APTA was never really a huge factor. You didn't see a lot of value in it at the time. And that's, I think that's a very common thing that students feel all the time. What do you think is the school's role in implementing APTA membership and the awareness of involvement? Do you think it's something that is rightly preached at schools?
I mean, I want to say no, but at the same time, I'm also very aware that I'm not the first to be like, let me get involved in school. I'm more of like, let me take my test and peace out, bye. So I'm not like, I found my community outside of school, and that's kind of what I always did. Like, I've always been the type who's not like super involved. I'm not going for like president roles and all this other stuff. So for me, maybe I just wasn't even aware of what was being talked about. So I might not even be the best person to ask about that, you know? But in terms of, I think what could be done in a school is just having more encouragement to maybe go to some of the APTA events, or sharing what the APTA is doing in terms of how they're kind of pulling us together, how they're creating community, how they're supporting other things, maybe. And especially if you're talking new grads and stuff, new grads are going to be on social media, new grads, like, how can we talk about the podcast that APTA is supporting? How can we talk about the social media that you can become involved in? And would you want to help in any social media outreach? And how can you help the APTA so that they can help you? Rather than it being like, let me just make my personal brand and break away from PT. It's almost like, building a separate thing and saying, I don't need to be a PT anymore. What if I didn't call myself a physical therapist? And I don't want to do that. But at the same time, when you're treating online and you have online programs, you're not treating, you're not diagnosing. So at the same time, I could step away from the profession. So how could we make it so it feels more inclusive and, again, just more supportive? And how can you enroll students to get in support of APTA and become more involved so that they feel the connection? Because when I was at Graham Sessions, I did feel the connection. And I do value you guys and what you guys have brought to the table and what you guys are creating. And I think it's beautiful. And I want to continue to be friends and associates. So, I think it's just continuing to say, again, how can we dive in and create this atmosphere of support and community? And how can we bring that awareness into new students? And I think that is moving with the age and moving with the times, and creating social platforms that they can, like, we can connect people so easy now. It's just creating that awareness and getting that social support. That's what social media is all about, is to build connections. So are we doing that? And could we be doing that in a better way that involves the students that actually know about social media nowadays?
Yeah, Jen, I think that, again, it seems like a lot of the common themes that we're hearing in these conversations is inclusiveness, community, support. Those are like the key words that I'm hearing. A lot of people, I think, have argued in the past that one of the reasons they're not APTA members is because of cost, because it costs too much. APTA has come up with many different ways to alleviate cost, including with the graduated levels for early career members, where you pay 80%, 60%, 40%, 20%, et cetera, et cetera. But what do you think? Do you think that cost is a major issue for people when they decide to become if they should be APTA members, or do you think it is more with this kind of value-based discussion, community-based discussion that we're having?
It's 100% value-driven. I mean, it's the same way me being an entrepreneur now, and I'm not going to sell a program unless someone knows the value of it, unless someone feels connected to it. I mean, the main thing too, it's like, unless someone feels connected to me, they're probably not buying my program. Like, most people are buying the program because I've shown up consistently day after day after day with content. And so I give a lot, and then I'm asking for something in return, but in a way that I'm not trying to just take your money, and I'm actually trying to help your body, and I'm really trying to teach you, and I'm really trying to help you grow. And so if that kind of value was set in place, in that the APTA really wants to help you grow as a physical therapist, really wants to connect you to amazing humans and amazing mentors that are actually going to be there for you, cost isn't an issue. People will find a way to pay if they know it's worth it every time.
I could not agree more with that. If you are demonstrating value, people will buy your product. And in this case, APTA membership. It is a product, right? Now, I'm going to challenge you just a little bit, and actually probably not just you here. This is a challenge to the 70+% of people who are not APT members. So in order to be a member of something, we know you have to feel connected, you have to feel supported, you have to feel like you are getting value directly from that membership. But there are so many intangible values that we take for granted, and maybe APTA needs to do a better job of articulating these, but you wouldn't be able to call yourself Doc Gen Fit if it wasn't for APTA action. We probably would not have the practice acts and the direct access and the rights that we have if it wasn't for legislation. Our reimbursement would be so much lower in PT if it wasn't for the active work of our lobbyists on the Hill. So while, yes, we need to do a better job of making people supported and feeling like they're getting direct value, but also the 30% of people who are paying for APTA membership are carrying the legislative burden for the rest of the profession. So how do you respond to that? Is there a rationale? You may have never even thought about that before because we don't do a good job of articulating it. But any thoughts there?
That value, that comes in terms of value. That is value. And that is pride as well. But it can't be pride from someone else telling you and someone else making you feel less than if you're not. It's pride of like, this is who you are. And it has to come like, you have to make someone feel the why behind it. You have to make someone feel proud of it as well. And if they don't feel proud internally and it's just being pushed onto like, well, this is what you should be and this is why, and it's almost like an attack and you're less than, or it's a fear mentality of like, well, you wouldn't have this if it wasn't for that. That's almost attacking from fear-based, which I don't know about most people. I don't respond from fear-based. So that's not going to make me motivated. That's not going to make me feel proud. That's going to make me feel like, whoa, like, okay, aggressive. And can we take a step back a little bit? And so I think really being mindful with how, we're internally getting people back into the why and back. And that starts in PT school. And that begins there. And it's like, if you want to continue to carry our profession forward, if you want to be proud of who you are as a physical therapist, join the membership because it's such an awesome place to be. You get to be like again, you've got to build in that community aspect and that pride and that why. Like, it's the same reason why I hate when physical therapists are saying like, well, they didn't get better because they didn't do their exercises. I'm like, no, that's on you. You didn't make them feel why it was important enough to do their exercises. So that's on you, not on the patient. And again, it's like, don't put that on the PT who's not a member because you didn't make it feel like, why should I join?
I think that's a great point, Jen. I know that like for me, I always try to talk about how APTA has benefited me. And over the years, I've gotten much more understanding about why people aren't members. Before I never would have understood why somebody wasn't a member because I had such a great experience. Like you said, I was a part of this community. I was very blinded. And as I've, gotten older and wiser, in my whole 30 years of age, I've gotten older and wiser, I understand obviously that people have different experiences and different motivations. And so my goal as an APTA member is always to my story, just like you tell your story on Instagram, and tell people how APTA has benefited me and to help other people feel really included in membership. I love it when people who've never been to an APTA conference go to a conference with me because I feel like I can introduce them to anyone and they're always like, oh my God, this experience was amazing. And I think that, we as members need to be reaching out to non-members in a way that's accepting, in a way that's not belittling them for not being members, and say, come with me. Let me show you. And if you don't like it, that's fine. But let me just show you what I see. And then, maybe they'll come along with you.
Mm-hmm. I 100% agree. And that's why I did appreciate coming and being able to meet you guys and feeling the connection and being like, oh yeah, this is PTs are pretty cool. I kind of forget. And also just, I think as people start to grow and are able to reach people in different ways, that's the people that you should be reaching out to. I mean, it's great to take one person and bring them to an APTA, but how far is that going to reach? Like if you're really starting to wanting to push change, you get to support the people like me who are out there repping our profession. Whether you agree with it or not, you're like, oh, her exercises are crazy. But I'm out there repping the profession to a huge audience. And I do have, even though I'm not marketing to physical therapists and chiropractors, I do have a lot following me.
Including me. Jen got me on Instagram. I have 25 posts on.
I know you're posting consistently. I'm like, oh, dang, look at Steph.
I know.
I was in the car when Jen showed Steph how to actually post on Instagram, so I can vouch for this.
I still can't figure out how to put all the little letters on my pictures, though. Jen, we're going to meet up again so you can show me.
Well, I will say, Jen, I think you were probably told this multiple times by multiple people who really have a large influence on the profession that we need you more than you need us at the APTA, right? So one of my next questions was going to be, how can APTA and its members continue to foster growth in membership? And I think we've answered that 5 times over. It's community. It's foster that sense of inclusion. Everybody is welcome. Everybody may fit slightly differently, but everybody is welcome here. And 2, let's keep up with the times, right? Mm-hmm. People are sprinting away from us in ways that are far more successful independently than with us, right? So how can we open our arms and attract those people such as yourself and others who are doing things ever so slightly differently in a very, very successful way? So let's think outside of the box and continue to push our boundaries.
Yeah. And I actually had a friend too tell me, because I took his new course, they're like pretty new grads, maybe 2 years out of school and already have a course that they're teaching nationwide. And when they were trying to get CEU certified for physical therapy, they got lots of pushback. And the first person that they went to talk to said, this will never be a CEU certified course. And then he got it and he went back and showed that person. But that's the lack of support. Like to tell someone you'll never do this, that's really not inclusive at all.
Right. But at least that guy could say, I told you so.
He can now. And that doesn't leave a good taste in someone's mouth to like push people forward, especially again, now he's creating courses that are touching people nationwide. You're going to get a lot of physical therapists coming to his courses. How could you support? How could you say, let's lean in, because you're going to be touching a lot more people than just who you see in the clinic over and over again.
And what do you think, this might be slightly off topic, so Stephanie, rein us in here if we're going haywire, but what do you think the balance between really sticking to and preaching evidence-based interventions and continuing education as a doctoral profession versus maybe more movement science that is less evidence-based? Because we see a lot of con ed going both directions. Both are utilized, both are important, both are potentially effective. How, as doctorally trained professionals, do we find a healthy path forward between those two?
Right. And maybe that means if someone's coming and they want to create a new CEU and it doesn't have as much research behind it, it's saying, this is an amazing idea. I think this can really go somewhere. How can we get more studies behind it? How can we help maybe fund some studies for you guys so that we can get you CEU approved or whatever it is to, again, support, right, not knock down.
Right. We need some sort of incubator, something to support and grow, foster innovation. Absolutely.
Yes.
Yeah, I think that, obviously, again, we keep coming back to these common themes of support, inclusiveness. We've talked a lot about branding and marketing. Do you think that APTA is doing a good job of marketing and being inclusive to new grads? And what are some strategies that we can potentially implement to help improve this community, this connection?
To be honest, I would have to look into the marketing and the branding a lot more to be able to answer that question. It's not something that I've really dove into to be able to make a fair assessment.
You're hired. Just kidding.
You're the brand expert here.
What are you signing up for? Jen, you can't hang out with Stephanie and I without expecting to get roped in somehow. So you signed up for this.
Your first assignment, Jen, is to go to their website and check out their website and just see what.
Of course. Yeah.
Well, I know over the last couple of years, even with each specific component. So like, for example, the Academy for PT Education, we've done a lot of rebranding. They've gotten a new logo, they've redone their website, they've branded their journal. And, one of the things that I've hoped to help the section with, or the Academy with, has been trying to reach some of these younger members. Because I think that the Academy is a great place to go. A lot of people think of the Academy for PT Education as a section that is for people who are teaching in the classroom. And that's not true. I mean, as physical therapists, we're all educators. Jen, you're educating everybody about different exercises that can, the general public. Keaton is educating people every day that she sees in her clinic. I'm educating people every day. And I think that trying to, again, foster that community, foster that inclusiveness is what is going to make APTA even more exceptional and even reach a larger audience. Do you have any advice? I mean, you've done a lot in your career. Do you have any advice to the early career professional about their practice in general, or kind of some wisdom that you can pass on to them based on your experiences?
Yeah, I mean, for me, I really highly recommend always staying open to growth and possibilities, because you never know where it's going to take you. Again, I never knew that posting on social media would start to turn into a business. And I have met several different practitioners throughout the years that have continued to push me in opening my mindset and thinking of things in a different way. When I first got into physical therapy school, it was because I was anti-chiropractic. And I was like, not that way, this way. But as I've moved through and I've met chiropractors, I see how we can support each other and learn from each other. And though I'm proud to be a physical therapist, I can still say the chiropractors that I learned from, and I'm able to implement practices into my own work and what I do and how I teach and how I treat. And so continue to stay open-minded, continue to explore and ask and outreach to anyone. I think as new grads, you get really scared and you're like, we take boards and we learn great tools in terms of how to diagnose and how not to kill someone and when to refer out. But not necessarily how to treat a whole human, because we're not body parts. We're taught through body parts, but we work as a whole. And so continue to learn the tools in order to talk to a human. And that means not only looking at their whole body, but that means making the connection internally as well, and supporting a human emotionally and in their personal lives and what they're doing. And so especially if you want to build a practice, especially if you want to outreach to general population, you have to connect with them. And that's the one thing that's missing from MDs that we get to do as PTs. We get to spend more time. We get to actually connect with people. And even if you work in a mill and you're getting turned over, one of the most important things can be to just make that connection in 15 minutes, 30 minutes, whatever it may be, more so, I would say, even than what you do technically. So continue to push the awesome human that you are, and lead into that and believe in that, and know that with the world opening and technology in so many ways, there's so many more ways that we're going to be able to help more people. And so continue to think out of the box, continue to push boundaries, continue to say, here's a problem I see. How can I move into that? How can I fix that? And I'll see innovators. I want to see more people pushing boundaries and creating new things in the world. And I'm here to support. I meet up with a lot of physical therapists that are in LA area, students to regular PTs. And I always try to meet up if I can, because I'm here to support and I'm here to help and I'm here to push us forward, even if I'm not a member.
Oh, Jen, that was so inspirational. I hope you knew Greg listening to that. That was bomb. Well, on the Healthcare Education Transformation Podcast, we always kind of end our podcast with a very standardized question. So I'm going to ask this to you because I'm curious about what you think. If you could change one aspect of healthcare education in DPT or any other field, what would you change and how would you change it?
What would I change? I mean, that can go so many different ways. I would just, I almost want insurances not to pay, not to say I want them to open up their mindsets to know that healthcare professionals, in terms of physical therapists, especially, and chiropractors, and probably acupuncturists who are great and maybe include some movement stuff, should be the first role. So if you are going to use insurance, we should be the primary providers, and then we know when to refer out. Physical therapists we have our doctorate degree because we learn differential diagnosis. We learn when to refer out. And so go to your physical therapist first, go to your chiropractor first, and then use insurance for MD if you need to.
I will say, so I, just like you, Jen, practice in a purely cash pay model, or I should say out of network model. And there is something to be said about not relying on the guaranteed reimbursement of insurance. And I put guaranteed in quotation marks, but when a patient is paying cash for your services, you have to demonstrate immeasurable value for that patient to come back. That patient has to be invested wholeheartedly and financially and see value in what you do. And if every single PT practiced, I don't think they should practice in a cash pay model, because then that would be a whole mess. But if they practice as though they were in a cash pay model under the insurance system, the value we demonstrate to society through PT would be exponential. So I could not agree more. It's really a salient point. So to wrap things up a little bit, you have given us so much valuable information, and truly I think it is a huge monumental opportunity for us individually, personally, and also for the APTA to have somebody as open and honest and transparent as yourself on the podcast with us and talking about these kind of uncomfortable member versus non-member kind of issues. I don't even like that that's a phrase. Maybe we're just all PTs, right? Having an open, honest conversation. So a few things to keep in mind. I mean, for PTs who are currently not APTA members, and for those who are, keep your mind open to the intangible benefits that membership is bringing you, right? So don't discount those legislative, those legal, those Practice Act type of things that the APTA is doing for you. And then, hey, PTA, here's for you. Let's work on our freaking brand, right? PT needs a better brand. We need a stronger brand. And us millennials, we're moving fast and furious away from your brand. So challenge accepted. I'm an APTA member. I'm accepting that challenge. I'm a millennial. So I think we're in good hands moving forward, but this is a wake-up call. We got to do something different. So Jen, tell us, how can people follow you? How can they get in contact with you? What is the next step for you?
People can find me, Doc Jen Fit, on all the things: Instagram, YouTube, Facebook, website. Keep it very simple for everyone. So Doc Jen Fit on all of that stuff. And, I'm moving forward and just trying to continue to educate the general population, and however I can do that to continue to reach and empower people back into their own bodies is my goal.
Oh, this has been an amazing conversation with two of my very good friends. Thank you, Jen, for opening up to us and really helping us learn something about branding today, talk about membership, and really try to get some of these ideas bubbling. So hopefully that, the leaders who listen to the Healthcare Education Transformation podcast, hopefully they're walking away and they have some really great information to really make APTA even better than what it is now. And Keaton, thank you so much for being a co-host with me today and being our guest host. We always love bringing some new guest hosts on every so often. And for all of you who listen to this episode, we'd love to hear your thoughts on it. Thank you once again for listening to the Healthcare Education Transformation Podcast.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available in our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.